Hi, my name is Olivia Farrow, and this is my elevator pitch, What is a Nurse Practitioner, for NU 668. What is a nurse practitioner? Well, nurse practitioners are nurses that complete additional graduate level schooling. They first have to receive a bachelor's degree in nursing, and then they go on to receive their graduate degree in a master's in science of nursing, or they require a master's as a specialized nurse practitioner, such as a family nurse practitioner, geriatric nurse practitioner, so specific populations they can specialize in. How does a nurse practitioner differ from a physician assistant? Nurse practitioners receive a master's degree from a nursing program, while physician assistants have to receive a master's from a specific medical program. Nurse practitioners are a little bit more focused level of care, and they can receive their education on specific patient populations, while physician assistants can often be in more generalized medical care. Nurse practitioners can prescribe medications and operate independently in 27 states in the United States, so not every state within the United States allows nurse practitioners to use their full scope of practice and authority, while physician assistants work interdependently with physicians, so they have to work under a physician in order to assess, treat, and prescribe. How does a nurse practitioner differ from a physician assistant? The education is a huge piece in this. Nurse practitioners must complete undergraduate degrees and receive a Bachelor's of Science in Nursing. Then they have to go on and take the test called the NCLEX test, which then allows them to become a registered nurse within the state that they live in and practice. And you must stay on top of these credentials in order to keep your licensure. But then if you want to pursue becoming a nurse practitioner, you have to apply and graduate from a Master's of Science in Nursing or doctorate program in which you can have a specific area of focus, such as family, geriatric, psychiatric, women's health, pediatric, so on and so forth. And then you have to sit and take a certification exam to become a nurse practitioner. While a physician assistant, you have to complete a bachelor's degree, apply and pass a physician assistant program, and then sit and pass for the physician assistant national certifying exam. How does a nurse practitioner differ from a physician? Well, doctors have quite a bit more schooling. They first need to complete a bachelor's degree in either biology or chemistry. They must study and then take the MCAT, otherwise known as the Medical College Admissions Test, and then apply to a medical school. They have to attend and graduate from an accredited medical school, typically 4 years in length, and then they must sit and pass the boards to become licensed within the state. Doctors have a lot more autonomy and authority in a lot of ways compared to nurse practitioners. They can prescribe medications independently within all 50 states and operate independently. Nurse practitioners, however, are unfortunately limited in quite a few states under what they can and cannot do. 27 states allow full scope of practice, but full practice authority is the authorization of nurse practitioners to be able to assess, treat, which includes prescribe medications, as well as diagnose medical illnesses. And this autonomy, unfortunately, is not granted in all 50 states. And thus, they have to work directly under a medical provider's licensure in order to get the authorization from the doctor to prescribe a certain medication or diagnose a certain illness. And lastly, why don't you just become a physician? I want to consider the whole person. I've always really appreciated and loved the holistic approach. I think that treating a person is from the mind in terms of emotion, spiritual, and physical. Not only just the medical issues at hand. So with that, I got my education and background in nursing, and I want to continue on with this model in mind. Pursue higher education, have more autonomy, and be able to make a difference within my patients' lives. Here are my references, and thank you so much for watching.